my name is Lynn Kay. I'm a 68-year-old retiree. I worked as a vocational rehabilitation consultant for about 25 years, and prior to that I was a special education teacher. I have a master's degree in vocational rehabilitation consulting and a master's degree in behavioral psychology. So I consider myself not the easiest patient to work with because I have a little bit of knowledge, and we know how dangerous that is. When I first started coming to the clinic, I had been off all of my medications for almost a year, and I was at the bottom of my rope as far as depression goes. Diabetes was completely out of control in the 400 and 500 blood sugar ranges. And I knew what was going on, but because of the severity of the depression, I was so totally non-functional, I couldn't do anything. I was like a frozen popsicle, I just lay there. When I started with the clinic, I had to switch doctors because of my retirement and insurance plans. I had problems with the clinic going through an overhaul of their computer programs and all of the glitches, the mix-ups in medications, going to the wrong pharmacies, and it was just a nightmare added on top of a nightmare. And it was at this time that I started working with the pharmacist Molly, who really started putting things in perspective. I could contact her and tell her what the problem was, and she could work out a solution. She's a wonderful go-between between myself and the doctor, because they have a good cooperative team effort in practicing medication. So what I cannot comfortably say to my doctor, I can say to Molly, and this gets transferred, and that really enhances my medical care. My health is much better to date because now I'm updated on all of the medications I need. I'm taking them consistently, and I've also stopped smoking, which I think is absolutely remarkable because I smoked since I was 15 years old. But having the knowledge and the education about why my legs cramp up and hurt so bad, and I already knew about the sinus infections and the allergies, but I did not understand all of the effects that tobacco was having, and Molly really did some good training with me on that and gave me a lot of motivation, because I don't want to live like this. I want a better quality of living.